Thank you so much for your interest in the course. So in the next 20 minutes or so, I'm going to give you an overview about the course, and of course, I would be delighted to answer any questions that you have about the course. So this is the Master in Sports Cardiology offered by our university. So I think probably to introduce the topic, we should talk about what is sports cardiology. So sports cardiology is a developing branch of cardiology that is focused on the cardiac care of the athletes. And one of the main fears is sudden cardiac death in athletes, which is something that is rare, is always tragic, usually occurs in young athletes. So there is not only, we should not only consider how common or how rare these events are, but also the years of life that are lost for these young individuals. And sudden cardiac death in athletes is almost a paradoxical event, if you like, because athletes, especially elite or professional athletes, in some way epitomize health, and they perform at a very high level. And when they die suddenly, it's as I said, it's almost paradoxical. Okay, so as we said, sports cardiology is a rapidly evolving field. There are several aspects that we should consider. So the promotion of physical activity in individuals who have a cardiovascular disease, but also the aspect of pre-participation screening. So how are we able to identify, we'll see with simple tests often, individuals who are athletes who may have an underlying cardiac disease that may be very dangerous. We have to consider that we have an increasing number of amateur athletes, so not only professional or elite athletes, and of course we need to care for them. Okay, so the Sports Cardiology MSc at St. George's is the first structured teaching program in the world. It's a unique qualification. Just to give you a little bit of understanding of the expertise and the capacity. So Professor Sanjay Sharma, Professor Papadakis, myself, we all lead on this course, okay? And we try to make sure that you have a wonderful experience, that you learn a lot, and basically that at the end of this course, you are independent in assessing athletes from a cardiac perspective. We don't work in a vacuum, but there is a large team of consultants, cardiology consultants, trainees, so PhD students that work with us, clinical fellows, SPRs, ICC specialist nurses. They work with us in our sports cardiology clinic, which is the only sports cardiology clinic in the UK, and provide expertise and care for the athletes that we assess. We assess athletes from all over the United Kingdom because, as I just mentioned, this is the only sports cardiology unit in the United Kingdom. So we tend to see patients or generally athletes who are referred for possible underlying cardiac condition from all over the United Kingdom. Okay, we work very close to the charity Cardiac Risk in the Young, and the charity Cardiac Risk in the Young offers and promotes cardiac screening in young individuals, including athletes, and the charity screens more than 30,000 individuals per year, and we lead on this program. Okay, so our students have the opportunity to be exposed to this kind of experiences, to see high-level athletes who are screened as part of their mandatory screening. We work with a big inherited cardiac disease unit. Actually, more than 2,000 patients written here. At the moment, we're more than 5,000 patients seen every year. Okay, we do quite a lot of research in the field of sports cardiology and inherited cardiac condition, and there is a state-of-art equipment including ECGs, Holter, cardiac MRI, cardiopulmonary test, and other investigation that may be useful in this context. Okay. So as I mentioned, we don't work by ourselves, but we work very closely to a series of organizations, sporting organizations. So, for example, the Rugby Football Union, the Football Association, the English Institute of Sport, the London Marathon, and the English Cricket Board. And we see athletes belonging to this particular sports every year. Okay, so we see them as in the process of cardiac screening, and of course, if there is something wrong, we tend to see them in our clinic here at St. George's Hospital. We are very close to scientific associations, including the European Society of Cardiology, and particularly its branch of the European Association of Preventive Cardiology, but also the British Association of Sports and Exercise Medicine. As I mentioned before, Cardiac Risk in the Young is very close to us. We work together in partnership with them, and also with international academic institutions, which actually help us a lot in developing the course itself. We have experts from all over the world, Europe, United States, Australia, who join our course and teach. Okay. And the sports cardiology curriculum has been developed a few years ago. There has been some minor updates, but it's something that really, the development of these documents really reflects the need to have a good understanding, a standardized understanding of what is needed, what kind of training is needed to become a sports cardiologist, to become an expert in sports cardiology. Okay, and this is just a summary of the areas that are covered within the master. Okay, so we'll start from cardiac anatomy and exercise physiology. Of course, we will focus quite a lot on cardiac adaptation to exercise. This is very important because we need to understand what is the normal, what is the physiological in athletes to try to pin down what is abnormal, what is pathological. We would focus quite a lot on cardiac screening because, as I said at the beginning, we want you to be independent on this. So we want you to be able to independently assess individuals, athletes, young athletes who are screened, and make sure that you understand which individuals would need further investigations and which individuals instead do not need further investigations. We would cover the area of inherited cardiac conditions and genetics, cardiac rehabilitation, exercise prescription, which is something that has developed quite a lot in the last few years, and the issue of substance abuse in sports, emergency response planning, and also the aspect of COVID-19 and exercise. So what are the candidates? What are the possible candidates? I would say that the range is quite wide. From physicians, so consultant cardiologists, junior doctors or SPRs, clinical fellows, cardiac physiologists, cardiac physiotherapists, sports scientists, nurses. We had all those kind of professional areas in our MSc during the last 10 years. We have also medical students that had the MSc as part of an intercalated degree. The entry criteria are, generally speaking, having an undergraduate degree, 2 years or practical experience. This is kind of flexible. It is assessed by us. Basic understanding of ECG interpretation, and then English language skills. Okay, and this is an idea of what the master looks like. So just to summarize, the master has 180 credits, but you don't need necessarily to have the master to develop the master in sports cardiology. You can also have a diploma, which is 120 credits, or a certificate, a postgraduate certificate, 60 credits. Okay, so as you see, there are 6 compulsory mandatory modules and 2 optional modules, and you see that every module has 15 credits. So if you have if you do all the modules, basically you get 120 credits. To get the MSc, you need to complete a thesis. So you need to do an original research project, and we we follow you to make sure to ensure that you will be successful in doing that, to add the 60 credits to the 120 credits that you gain from the modules. Okay, and this is an example of a full-time MSc. So we offer full-time MSc 1 year or part-time MSc 2 years. Okay, so basically this is the organizations of the modules for a full-time module. So you see there is a series of modules that in some way are complementary to each other. The general gist of it is that there are some principles first, some theory, let's say, and then there is a practical aspect. So often the modules have a first module that is a principle or theory, and that is followed by a practice module, which means clinical cases that you will discuss with us in the classroom, and you will be asked to discuss with us in an interactive way. That's the best way to learn, isn't it? So if you have, so there are also some optional modules, as you see. One of those is the research methods module, which is not necessary if you already have a postgraduate degree. And then there are other modules, other optional modules, including an emergency response planning, cardiovascular genetics and advanced management of inherited cardiac conditions, ethical, legal, and social issues applied in genomics, and counseling skills in genomics. Okay. The platform that we use is Canvas, which is very user-friendly, very easy to use. Basically, on Canvas, all the lectures are summarized and are recorded. So you will be able to see the PowerPoint or the PDF of the lecture, but also the actual recording of the lectures. Okay, so for example, if you were not able to attend one of the lessons, you can go on Canvas and you can review the lesson on a video whenever you want. And that's very handy because, of course, you know, there is the possibility to miss a lecture. Also, there may be the need to repeat some concept that perhaps we're not able to metabolize when we saw the lesson face to face. We want to go back. We have the possibility to do that going through the video. Okay, and as I said, it's very user friendly. This is the general. So, for example, this is the cardiovascular anatomy and physiology module. You have everything there. You have the module overview. You have the units with all the lectures, the assessment, etc. Okay. And then also we always include some recommended readings, some articles that you may want to read that are pertinent to what we taught. There are some videos, additional videos that we include. So you have some material that you can go through to enhance your learning. Okay, and the lectures are always offered in a hybrid manner. Okay, so the lectures are face to face in the classroom, but for the students that cannot attend face to face, we always use Teams, and so the lecture is available for the students on Teams. Okay, this is an example of part-time MSc degree. So you see that there is year 1 and year 2, and basically we leave the student the decision on which module the student wants to take on the first year and on the second year. Again, there is quite a lot of flexibility on this. The only rule really is that you need to do the theory before doing the practice. So, for example, you cannot do practice of cardiovascular screening, which you see in the middle of the screen, before doing the theory of cardiovascular screening for obvious reasons. Okay, so another major aspect of the module are the assessments. So every module has assessments. And generally, the modules are organized where there is 1 week of intensive teaching, okay, 4 days a week. Only Wednesday is left for self-directed learning. The other days, there is intensive teaching, and then after that, there is the assessment. Usually, the assessment is an essay, so you need to write an essay basically showing that you have a good understanding of what you just learned. In some of the practical modules, there is also a logbook to complete and also some quizzes. Okay. There is ongoing support from Professor Papadakis and myself. We're there to support you, to make sure that you complete the assignments in time and you do a good job in that. So we have constant supervision, and of course the supervision is also meant to make sure that you complete your degree in time and you do a good job, you're successful in that. Okay, there are also research fellows which are very handy in this perspective, that are part of our team, and it's good to interact with them. They do also some teaching, some face-to-face teaching, and discussion of cases. So, and then there is a dedicated space within the NHS with a state-of-art equipment. We have a room within the hospital that is dedicated to our athletes with cardiopulmonary tests, echocardiogram, ECG, and we see them there. Okay, what will you get out of it? So probably that's one of your main questions. So this is a unique qualification, first of all. As I mentioned at the beginning, this is the only course of that kind on the international scale, the only MSc in sports cardiology. This is a center of excellence. It's the only sports cardiology unit in the UK. It has international reputation. We are part of international guidelines, international recommendations. It's a unique experience because you don't only have the opportunity to learn from experts in the field, not only us, of course, but also experts from all over Europe, the United States, and Australia. But you also have the opportunity to have an hands-on experience. So you can come and see practically athletes who are assessed in the context of cardio screening, or if they're referred here because there is a suspicion of underlying cardiovascular disease. Okay, it's a one step ahead of a certification process. And of course, it's a unique networking opportunities. Again, here you would meet a lot of people that are experts in sports cardiology on the international landscape, and that's very important. Okay, so you would enhance your career opportunities. The career opportunities really depend on your background. You would have the opportunity to work in the field of sports cardiology and inherited cardiac conditions. You can work, for example, for sports organization, for teams, specialist centers, charities, and you have the opportunity to enhance your chances to get into the cardiology field in general, not just sports cardiology, but especially if you are perhaps a little bit junior in your career, you may have the opportunity to get exposure to an important and developing field in cardiology. Okay, and these are our contacts as course director Michael Papadakis, myself, deputy course director. There are a lot of information online, and I will be very happy to take any questions from you. Thank you very much for your attention.
Yes, thank you very much for that. So this is the time, if you have any questions for our academic, Godo, if you have any questions for him, please do write them in the chat. I can see some questions coming through. Are there any limitations to doing this degree as a medical student compared to doing it after graduation, e.g. as an F3?
I will say the answer is no. There is no limitations. I mean, of course, as a medical student, you will have less experience in medicine just because you didn't have a clinical exposure. But certainly we had medical students who joined the course and were part of our course. As I said, there is quite a lot of flexibility. What we like is, generally speaking, from a clinical perspective, just to have a basic understanding of the electrocardiogram, because as you may understand, that there is quite a lot of exposure to ECGs, which is one of the, believe it or not, one of the most important investigations in sports cardiology, and you will see very difficult ECG. So just to have a basic understanding of the ECG, it's quite important. On a different note, we at St. George's, we organize an ECG course in the young and in athletes, which is a one-day course, which may be complementary to the MSc.
Thank you. We do have another questions here. 2 years part-time criteria, please. How many months criteria? Maybe they're asking how it is for 2 years part-time for this course. I think that's what they might be.
So yeah, so the part-time means 2 years, so 24 months. Full-time is 12 months. I'm not sure if I understood the question, but
I think that's maybe that's
hopefully I understood. Hopefully I answered.
Okay, someone's asking, I don't know if you might not know this, but I will put the admissions contact details in the chat. The question is admissions criteria for non-EU countries or third world countries, question mark. I'm not quite sure if you know how to answer that, but I can.
Yeah, so as you say, Colette, it would be important to contact admission. I mean, so the course has been taking place for the last 10 years, and every year we have probably, I would say, 56% of our students that are from non-EU countries. So certainly it's a possibility to be part of our course if you're non-UK, non-EU. Now, if you're asking me specifically if there are some criteria from the visa perspective, that's perhaps is best that you talk to admission. But as said, we have every year a good proportion of our students are from non-EU, non-UK. So I don't see it as a problem.
Perfect. Thank you for that. I've got another question. What kind of work experience can be gained as a sport science graduate? Is it a matter of contacting St. George's as the only sports cardiology unit? Sorry about
that. As a sports science graduate, I mean, I'm not sure if the student is asking outside of the MSc. Outside of the MSc, the honest answer is that I'm not too sure. But certainly within the MSc or the PG Cert or PG Dip, there is a work experience which is quite hands-on. Generally speaking, we tend to privilege our students to anyone else that may want to be part of our team or to join us. And we have lots of requests, which unfortunately we need to turn down sometimes because our students are our focus. So we want to privilege them. We want to make sure that they get all the work experience that is needed.
Okay, I think we have another question in regards to online, but I think you've answered this similar question. So it says, how many months we should be in the UK for the part-time course? I think you answered that already. And is it completely online? Sorry, that was the end of it.
Yeah. So yeah. Let me perhaps clarify. So as said before, we have every year many students that are outside of the UK, outside of Europe. The decision to how to take the course is dependent on them, because of course their background may be very different. The agreement with the hospital where they work, if they are doctors, may be very different. For example, we have 2 students from non-EU, non-UK at the moment who decided to stay here in London for 1 year, and they are on site. They had a good agreement with the hospital, and the hospital want them to stay here for the whole time. Okay, so they had clinical exposure, etc. This doesn't need to be that way. There could be some ways in the middle. As I said at the beginning, the lectures are always offered as a hybrid. Okay, our recommendation is to come to to St. George's, at least sometimes, at least for some of the weeks, because especially for the practical modules, because sometimes it may be easier to be on site, at least for some of the modules, because when you're on site, you get that kind of feeling that may be different from just attending a course online, especially when we have interactive cases, right? I'm not saying that, you know, if you're joining on Teams, that will not be useful. It is useful, and it may be useful also for the interactive aspect, but perhaps having some of the lectures done in the room would be useful. The modules, as I said, there are 8 modules. I would say most of the modules have 1 week of intensive teaching. So I hope that this gives you an idea of how much, how long you want to stay. And as I said, you know, there is a certain degree of flexibility in that. So I don't want to tell you you need to exactly stay, you know, 4 weeks or 5 weeks. It's you know, partly up to you. Okay, next question.
Yeah, sorry. I had my mic off. Sorry there. Sorry. The other questions are any differences between PG Cert versus PG Dip? Also, how long do the classes and lectures run? The reason I'm asking this is because the time zone differences from Asia and thinking of hybrid approach.
Right. Okay. So PG Cert and PG Dip. I think I showed you the slide before. The slide can be sent to you as well. So basically, the PG Dip has the whole modules, but not the thesis. Okay. So not the research project. The PG Cert has instead less modules. Let me just go back. I can share the slide again. Okay, let me see if I can do it. Okay. Hopefully you're able to see the slide. So as you see, 180 credits for the MSc. The PG Dip is 120 credits, which means the 8 modules. The PG Cert is 4 modules, okay, 60 credits. So that's basically the difference, okay? Let me just go back to, and sorry, the other question was, the reason I'm asking is because of time zone differences from Asia and thinking of hybrid approach. As I said before, let me just clarify. Yes, so we offer always hybrid. However, I would, let's say, discourage you to take the whole course as a hybrid. We want to see you sometimes, and we want you to attend some of the lectures. Now, if the question is, do I need to attend all the lectures, all the weeks? The answer is probably not. But we would like you to have some of the weeks face to face, because as I said, you know, it will be easier for you to learn. Okay, there is a certain degree of flexibility, but on the other side, I don't want to give the idea that the course, you know, is done everything, all the modules hybrid and done from remotely.
Thank you for that. As a sport cardiologist, how much of your time is spent in the specialist clinic and how much in other subspecialists of cardiology?
Okay, so in my experience, so from what I do, I spend probably of my clinical time, I would say 60% of my clinical time in the sports cardiology and inherited cardiac condition clinic. Yeah, I think you're muted, Colette.
Sorry about that. In regards to, sorry, this question says, in regards to the entry criteria for the MSc, it mentions having 2 years experience, unless I read it wrong. how would I achieve that as a sports science student?
2 years experience.
Mm.
I mean, that is one aspect that where there is a certain degree of flexibility. So what I would suggest is to contact admission. Usually we have a chat with you, and then we try to assess the level of experience may be, assessed, and there could be some flexibility depending of what we feel is your background knowledge. So it is not something black or white.
Yeah.
Hopefully that answer. I think also the same person asked what kind of work experience can be gained as a sports science graduate. Okay, I already answered that.
Yeah.
Yes, sorry. Yeah.
No, that's fine.
Okay.
Somebody else asked, job opportunities after this course. Do we need to pass any medical licensing exams in the UK?
Well, it depends on what you want to do, really. So it depends, of course, if you're a doctor, you need to do all the licensing exam that are needed for your career. I mean, the MSc is just something that adds up to your knowledge and expertise. You may not be a doctor, so you don't need to do certain medical exams that are needed from that perspective in that type of career. And I just want to emphasize that sports cardiology is not only for doctors, but it creates an expertise that in some way it doesn't have the boundary of our profession. And there are, I mean, in our course we have physiologists, nurses, sonographers that during the last 10 years have joined us.
Thank you. We have, what are the next steps required for those who want to study this course? Example, when do applications open and when are the interviews?
Okay, so usually the course starts in September. Now, if you're asking me exactly when is the deadline for the application, unfortunately, I can't remember that. But my suggestion is, if you're interested, you just get in touch with us. You just get in touch with the email address that I think Colette wrote. Yes, in the chat, the admissions, and they will be able to provide you with the dates, with the deadline. If you're interested, what I would recommend is also to just get in touch with us simply. Just if you want to have a chat, we can provide you some more information on top of what this lecture provided, and we can have a one-to-one chat, either myself or Michael Papadakis, and we can discuss. But I would suggest to get in touch with applications to get the exact date, which unfortunately I can't remember.
Yeah, and when you do contact admissions, just make sure you clearly explain what course you're talking about, because there's so many courses. So they'll be able to direct you to the right, to the right way, or give you the right information for what the course you exactly want to study. So make sure that your title has sports cardiology on it, or you quote that you're specifically, emailing about sports cardiology, so they can give you all the correct information that you require when emailing admissions. There's another question.
I'm also adding my
yes, please.
email.
That'd be great.
And Michael Papadakis email. So
yes,
I mean,
please.
if you're interested, just feel free to email us, and we can have a very informal meeting and chat, and we can go through things. Okay,
yeah,
perfect.
Yeah. There's two more questions here. How do people get referred to your sports cardiology clinic? Is it after a secondary care stay, or can they be referred from your GP?
Yeah, so it depends really. So what often happens is that athletes are referred by colleagues in the United Kingdom who are not too sure and have some doubts about the diagnosis or about how to manage the athlete, and they referred the athlete to us. So that could be one route. A second route could be via cardiac risk in the young. So our fellows are the doctors in cardiac risk in the young. So they are part of an organization, of course, a mobile unit which goes all over the United Kingdom, and they screen young individuals. They often screen 100 people a day. When they screen professional sporting organization, they screen probably around 30 athletes a day. And then if there is something abnormal, they would write a letter to the GP suggesting to refer the athlete to us at St. George's. So it's a social referral. So often we see athletes who are seen through cardiac risk in the young, and they're referred by our fellows because something was wrong or something was thought to be wrong. I would say, yeah, these are the main source of referrals from the athlete's perspective.
Thank you very much. There's a final question here that says, can you undertake the additional modules such as emergency response planning and or the genetics advanced management of inherited diseases, even if you just take PG cert only or need to upgrade to PG dip? I'm not quite sure if you can read, if you can see that message from where you are, just in case I read it all weird.
No, I understand the question. So, so you can, but in some way the modules are not recognized. So you can just attend the module if you like, as an external student. So let's put it that way. But that's not recognized within your degree in some way if you do the PG cert. But yeah, you can attend. Yes.
Perfect. That's all the questions that I have so far on my end. So if anybody has any more questions, we do have a few more minutes. Please do post them in the chat. Let me just see. There's a frequently asked questions that I have here in that spare time, just quickly for you. These are the frequently asked questions that we get sent to our emails. So there is a question that says projects, examples of project students that have done in the past, like their thesis. If there's any example projects that you can talk about that students have done in the past.
Sure. I can give you an example of a student that I followed. So usually the way it works is that Michael Papadakis, Professor Papadakis, and myself, we split the students, and each of us follow half of the students. And one of the main thing is to lead them through the thesis, through the degree, right? And I can just give you an example of a student who just successfully completed MSc. And she did a research project on cyclists, so on cardiac adaptation to exercise in cyclists. And we wanted to look specifically at young cyclists versus veteran cyclists. And we wanted to look at how the heart looks in these individuals. Okay, we wanted to, our main question was, is there any difference in someone who is very young, who is 25 years old and has cycled for, I don't know, the last 10 years versus someone who is 50 years old and has cycled for the last 3 decades. And we looked specifically at this aspect. We had very interesting results. And we looked together at all the ECGs and all the echocardiograms of these individuals. And the student had just submitted her thesis as an abstract at the European Society of Cardiology Congress. And hopefully we will get a good result. Hopefully this will be accepted as an abstract. I can provide you an example of someone who has done a thesis with me last year. And he went on to look at more than 5,000 individuals, including athletes, who had some repolarization abnormalities at the ECG, T-wave inversion specifically. And he looked at the rate of these abnormalities. And also we have, because we work, as I said, closely with CRI, we have complete data on follow-up as well, on events on these individuals. So he put down a very interesting project looking at the depth of the T-wave inversion and some additional features. And his abstract has been accepted at the European Society of Cardiology, which was in London a few months ago, and he spoke at the Congress, and we had quite a lot of interest in the abstract. So what I always try to say, this is an opportunity, the thesis, not only to complete, of course, your MSc, but also to get some visibility, also on the international scale, international congresses, to have the opportunity to present your research and to peers from all over the world. So these are just two examples. I hope it was clear enough.
Yeah, that was great. Thank you so much. I think there's one more question somebody's writing, and then we can probably wrap up the webinar. I'm just going to wait for them to send it through. I see them type in. But thank you so much. That was very informative, and it was very interactive. So I'm happy that they had some questions for you there. I'm just waiting for this question to come through.
No
You can
worries.
type in. Maybe a second. Okay, so this come through. MSc Sport Cardiology certificate is recognized worldwide. Is it recognized worldwide? Sorry, that's the question. Because as a doctor, I would like to pursue a career in the UK after this course.
Yes, it's a sports cardiology MSc is recognized worldwide. Yes, absolutely.
Okay, no, wait, there's one more to come through. I'm glad they're asking these questions now. We'll probably get them via email after this, so that's quite good.
That's okay. I can see that there is someone else who is writing.
Yeah.
Okay.
You're very welcome, Asif. Victoria is typing, so we'll just wait for your questions, Victoria.
Yeah.
Come through. Okay. Could you comment on the fact and sorry, my screen is a bit. Can you see it on your end? I think my
I can see. Can you comment the fat and carbohydrates metabolism during seabed? Is there an association between the fitness levels or the genetics has a central role? Okay, that's a very technical question. Well, I mean, what I would say, I mean, for the benefit of everyone, is that there are some specific lectures on the cardiopulmonary test, okay, that are delivered by experts in the field. And at the end of the course, you would know everything about cardiopulmonary test. To answer to the specific question, if there is an association between fitness levels and genetics, I think it's difficult to say, because to my knowledge, at least, there have not been like specific studies that addressed this question. And as you know, the level of exercise tolerance may be very different in the individual. Also, in the same individual, may be different, considered different time in their life, and with different factors that may affect them. So, yeah.
Yeah, perfect. Thank you. I've got a question here. Hi, I'm a GP interested in sports medicine and cardiology. Have you had GPs on the program?
We had many GPs in the program. Many GPs. Yeah.
I think this question is about admissions. Let me just read this one. When we email admissions, we'll be informed regarding the details, possibility, admissions, payment details, and take up if we're eligible to undertake the course. Do you want to answer that? Should I?
When we email the admission for inquiry, we'll be informed regarding the details of possibility. Yes, I will say so. Admission would be the best people to talk to about those specific aspects. If you have any question regarding the academic aspect of the course, probably it's best to talk to us. But or administrative aspects, probably it's best to talk to them.
Yeah.
Will be interviewed by yourself or Professor Michael Papadakis. It depends. I would say Professor Papadakis usually does most of the interviews.
Yeah. So
but as I said before, just to clarify, you can just contact us and have some informal discussion with no pressure, right? So I mean, you can email us and without an interview, just having a chat about the course.
So this come to the end of the webinar. Thank you very much for your time, and I hope you have a wonderful rest of your day.
Thank you. Bye-bye.
Thank you. Bye-bye.